Good day everyone, welcome to Renix Academy. I'm your Husky tutor, your Husky guide here for today, and I'm midwife, a nurse midwife, Victoria. And today I'll be showing you how to carry out vaginal examination. So first of all, let's have an idea as to what vaginal examination entails. Okay, we all know that vaginal examination, we are examining the vagina. But why are we examining the vagina? First of all, we are to examine the vagina to actually check for any form of abnormality, to check if the vagina is in a good state, and also, the cervix. Doing vaginal examination to also check for or to monitor labor. Monitor labor in the sense that while the pregnant woman is in labor, we are to check the state of the cervix, cervical dilatation and cervical effacement. So that's what vaginal examination helps us to do. And vaginal examination is also needed to be able to obtain samples, what we call vulvar swab and vaginal swab. So that's the basic reason why we actually carry out vaginal examination. So how do we go about this vaginal examination? First of all, we need to set up our instrument. And I would like to let you know that vaginal examination is a very sterile procedure. It's a tray procedure and it's very sterile. So this is a sterile feed. As you can see, we have the gallipot. We have another gallipot here containing the vaginal swab. I will not be opening that because this is sterile. Then we have the sponge faucet to be able to pick up your swab. Then we have this non-sterile, and that's why you see that we're able to separate it. This is your salmon. That's your disinfectant. This is your KY gel. That's your lubricant. We have normal examination gloves here. Then we have your apron. Then you have your sterile glove. So we are starting the procedure right away. But before we go ahead, I would like to greet my patient. Hi, good afternoon, Mrs. Ngozi. How are you doing today? I'm Midwife Soje, and I will be performing a vaginal examination for you, and basically to be able to monitor your labor. I know that you and your baby are in a very good state, but let's check how far you've gone. So that's what vaginal examination is usually all about, to be able to monitor your labor, to check if you are good to go to actually go into the delivery room for your normal delivery. So am I permitted to go ahead? Okay, thank you. So you could see that I explained the procedure to the patient, and I also tell the patient what the procedure is all about, and at the same time take an informed consent if I'm permitted to be able to carry out the examination. And she has replied me, she gave me a go ahead. Thank you so much. So what next for me to do? I wash my hands. Okay, after washing my hand, I have to dry my hand, right? So you can use your elbow. Just do that. So my hand is clean. So I will need an assistant to help me open this sterile glove, in a sterile way. Thank you. So as I'm wearing my glove, I'll tell my assistant to also help me pour this solution into the gallipot. Please ensure that you don't touch the sterile film. Yeah, thank you. So after donning my glove, the next thing for me to do is to disinfect the vulvar area. So that is the essence of the sponge holding faucet, and then we have the cotton swab. So you use your faucet to pick your cotton swab. Okay. So we are cleaning from. So this is your dominant hand actually. So you use that to be able to show the labia majora and the labia minora very well. So we are starting from the there is near me. So we're starting from here. And that's the essence of the marking touch. The marking touch is there so that any fluid or any solution, the marking touch will be able to absorb it and you're not going to soil the bed. And you will notice that the sterile feed is also near me. I'm not putting it on the other side. That's the essence of the sterile feed. Your sterile feed is expected to be closer to you. So let's do this. We are also going to be cleaning the labia minora now. Just once, it's a one stroke you drop. So we are cleaning the labia minora, the vestibule, and all of that. So you can return this. So after cleaning, we are about to go in. But before you go in, we have to lubricate our hands so that it's not going to pain the patient. The patient is not going to feel it. But before we even go about lubricants, we also need to ask the patient if the patient has void, if the patient has passed urine, so that there will not be any form of obstruction or it will not be painful. So Mrs. Chase, have you urinated? Do you feel fresh? Oh, okay, you've urinated and you're not feeling fresh. So you can go ahead. So now let's lubricate. I will need an assistant to just help me pour the lubricant here so I can actually lubricate my fingers. Okay. So I'm lubricating my index finger and my middle finger because these two fingers are what I need to actually be able to go in. So as you can see, I'm doing this in such a way that it's not going to be less painful to my patient when I'm inserting. And as you can see that my patient is in the nidotomy position, or should I say dorsal recumbent position, it's giving me more opportunity for me to be able to go. So ensure that your patient is actually in a dorsal recumbent position. And as you can see, all those, as you can see me ensuring privacy, you could see the curtains and everything. So please keep that in mind, very important. So I'm going in now. I'm using my non-dominant to separate the labias. Index finger, we are going into the vagina. There is an opening called the vaginal opening. So you are going to pass through there, extend down in a downward and a backward motion. So this woman, as we said, is a pregnant woman, and of course we know that there will be dilatation. So as we go in, you'll be able to touch the tip of this